Hello and welcome to Bristol Health Cares. I'm your host, Kurt Barwis. I am the president and CEO of Bristol Health. This program is for you. It's really about how you navigate the system of care, how you access care, and it's really about trying to answer questions you may have and really didn't know who to ask. We are going to bring to you professionals, doctors, surgeons, other healthcare professionals throughout our system of care, maybe people that you've never talked to before or met before, but the goal is to really help you understand how to access care when you need it. You're going to enjoy this program. This program is really for you. So what's important is if there is something that you want to learn about or know about or a guest that you'd like me to host on this show, write us and we'll try to make that happen for you. So enjoy the program, Bristol Health Cares. Hello and welcome to this episode of Bristol Health Cares. I am your host, Kurt Barwis. Really excited today to have on my show Ashley Goad, APRN. She's a primary care APRN for Bristol Health in the Terryville location. Ashley, good morning. How are you today?
Thank you so much for having me. I appreciate this opportunity.
So it's exciting to have you on the show because I think you're the first APRN that I've had on the show.
Ooh,
and I think that's really important because I think the viewing audience really wants to understand more about how you practice in primary care and stuff like that. But let's start with the journey. Like, how did you get to be an APRN?
Sure. So it's actually a pretty long journey through Bristol Health. I, fresh out of CNA school, I was super excited. I really wanted a hospital job. So right away, I applied to Bristol Health. While working at the hospital, I was on a medical surgical telemetry floor, got my RN, was on med-surg tele again. I worked in the emergency department, and then a coworker convinced me to apply to a nursing supervisor position, and it's just with great pride and honor I was able to land that position and work the hospital on the weekends during the COVID pandemic as nursing supervisor. I learned so much. It's incredible how much work really goes into that. And during that time, I was in nurse practitioner school and I graduated, and I always knew I wanted to be a NP at Bristol Health. So here we are. I'm in internal medicine today, and it's great.
Wow. So that's really an amazing journey. And you know, I talked to you a little bit earlier. So I remember my first interview at a hospital was for Central Sterile Supply, and I got turned down. And it took, the second interview was the charm, right? So, and similar to you, I think in that hospital, I had probably 5 or 6 different jobs. So I took the same. I don't think people realize what an amazing environment a hospital can be in terms of helping develop your career and the pathway and really kind of finding where your heart is, you know, in terms of, you know, what you want to do and what you want to be. And it's just a great support. Sounds like we were a great support structure, but we also probably, that was a very difficult job to be a nursing supervisor during the pandemic.
Yes.
So tell me what biggest challenges that you had.
Probably biggest challenge was being in an incident command meeting and receiving a helicopter at the same time during a pandemic.
Yeah.
That was probably all-time high stress, but I loved it. It was a really good way for me to kind of find my voice and really just appreciate every single position that goes into the hospital, whether it's, you know, maintenance. They really play a huge role, especially, you know, during the off shift hours. We really have a lot of resources that we can rely on, and everybody at Bristol just really works as a team.
Yeah.
So I'm very lucky to have had that opportunity. I've learned so much, and I wouldn't have been in this position where I am today if I didn't have that background.
Yeah, I think you know, it's kind of an interesting thing. I tell people this and I don't think they believe me, but there's always somebody in charge at the hospital 24/7, 365. Never not somebody there that's right in charge. And you know, I'm the president and CEO, and I don't think people realize that when you were acting as the nursing supervisor, you have all the authority that I have when you're working there. So huge responsibility. I mean, there can be incredible things that happen, as you described.
Yes.
I always wondered, so people call you when there's a helicopter that's coming in?
Oh yeah, there's a whole big process that's involved with security. Basically, it takes a village, to make this happen. And it was just really an excellent learning experience. Like I said, I kind of found my voice and was able to work with everybody in the multidisciplinary team to make this happen, to give the best possible care to our patients.
Yeah. So you picked primary care. So talk to me a little bit about that. What made you do that?
Sure. So I have worked up the chain and kind of gotten to know the acute disease process and working onto the chronic disease process. So from taking that medicine as a whole, just kind of learning and implementing everything along the way has brought me to where I am today. And I have the strong background in order to support our patients in primary care.
Yeah, that's awesome. So you got this healthcare bug really early on.
Yeah.
Right?
Yes.
So I imagine right out of school.
I actually was a hairdresser at first.
Oh, is that right?
Yeah.
We have a lot of hairdressers. We have a vice president that was a hairdresser before.
Oh, really?
She was the vice president. Yes. That's good. I don't really have any need for a hairdresser anymore, but no. So that's really pretty exciting that you made that transition. Not an easy transition either.
No. Worth every single part of the journey is worth it. It really is a journey and overcoming challenges, and I love taking on a challenge. So.
Oh, good for you. So you're working also in the office with Dr. Chernesky, right?
Yes.
So he's been, I think he's almost been in Bristol Health as long as me, 17 years.
Yeah, that's amazing.
He's really an incredibly nice person.
He's incredible. He is a fantastic resource. He has a very large patient panel, and all his patients love him.
Yeah.
So he's really great to work with.
So you know that there's seats in his office. You know what those seats are? Those seats from a stadium? Does he still have them in the office?
Yes, he does. Yes, he does.
Do you know where they're from?
I don't.
So they're from Veterans Stadium in Philadelphia. He is a diehard Eagles fan, so sorry for that, but I just have to tell you, he actually has seats from the stadium before they knocked it down. And whenever I talk to him, we talk about Philadelphia Eagles, which is, kind of his passion.
Yes.
And you would have never known that except for the seats being in his office, right?
Absolutely. Yeah.
Do you like football?
I watch it here and there, but I'm not a diehard fan as he is.
It's really confusing being in Connecticut. So there's the people that are the Patriots, and then there's the Giants, and then there's the Jets. It's kind of good to be someone that has a different team sometimes.
Some good college competition.
So talk a little bit about the community that you serve, Terryville, Plymouth. I mean, so where are you from originally? Are you from Bristol?
I'm actually from Thomaston.
From Thomaston.
So right down the road from Terryville. So it's nice to see kind of some familiar faces come through the Terryville office. It's a great community to work in. There's a need for primary care there, and I'm happy to fulfill that need.
Yeah, so a lot going on. I mean, it seems like the entire center of town is being reconstructed. I try to avoid it at all costs. They're digging up the streets, and I'm worried about getting flat tires. But it's it's a great location, as you said, and you draw from not just Terryville, Plymouth. You draw from Thomaston and many other areas.
Right.
It seems like patients come in. And then, so in that office, so you have primary care. Is there also a counselor in there too at times?
There used to be at one point in time, but not anymore. So we just it's myself and Dr. Chernesky in that office for now. And
now, do you do lab draws there too?
Yes, we do have
lab
a full
draws, so people can come in and have lab draws done. Having the integrative behavioral health, did that work in that environment, or was there a reason just because of turnover we lost the person? Is that how we stopped it? I'm sorry if you don't know all the background. I'm just curious.
It's okay. So the behavioral health therapist was not there as I was onboarding, so I don't have that experience working with that person. I think they have since moved to the behavioral health in the center of Bristol, the counseling center. But it's still wonderful to have both myself, Dr. Chernaski, available, taking on new patients, and it's great. We have the phlebotomist right there, so you come in for an appointment. It's as easy as that, and then you get blood drawn right across the hallway, get your results on the patient portal, and we find a lot of patients very satisfied with that.
So talk to me about like the age groups that you treat. So do you go cradle to grave? Do you do? I mean, that's probably a bad way to say it, but people do refer to it that way. Do you do kids? Do you do adults? So tell me the range.
So I'm actually a family nurse practitioner, so I can see everybody. However, this is an internal medicine, so we typically see ages 18 and up, but as I'm a family nurse practitioner, I will see ages 16 and up.
Very good.
We just don't do well visits, as we don't have all the immunizations as required in a pediatric population, but I will see patients 16 and up.
So I'm thinking like, high school kids, right?
Yeah.
They start, well, they're probably halfway through at 16, right?
Yeah.
Yeah. Yeah, so a lot of parents ask me about physicals and things like that. So you could do those things. You could do physicals for high school kids that are 16.
Just not immunizations.
Just not the immunizations. Got it. Okay, that makes sense. And so talk to me a little bit about, like, do you have a focus in primary care? I mean, obviously you see a range of patients with diabetes, COPD, other conditions. Like, is there like any one particular area that you really kind of like focus on and love, or is it just like all of them?
So I love to see patients of all ages. I don't really have a particular niche at this point in time. In my hospital days, I love emergency medicine, like the action. But it's really nice to kind of move on to the chronic disease process. So we'll see patients with diabetes, cardiovascular disease, COPD, you name it, we'll see it. And if we need to refer to a specialty, we have all those wonderful Bristol Health Medical Group specialties that we can choose from. So we really try to keep it in the network and provide that continuity of care.
That's awesome. So it seems like, in the 17 years I've been here, we've made an incredible transition in terms of community acceptance of physician extenders, so APRNs, PAs, and things like that. Do you see any resistance or challenge to it, or is it just what I perceive now as people want to be seen, they want to be taken care of, whether it's a doctor or an APRN?
Sure. So they're certainly similar in many ways. However, I find a lot of patients like to see nurse practitioners as well as doctors. I feel there's different schooling that MDs go through versus PAs and NPs. And I know it can be kind of confusing once we get into all those alphabet soup terms with all the letters behind your name and whatnot. But I'm more than happy to see any patient. As nurse practitioners, I feel as if we have a more holistic approach. And I think that's, one of the key differences between all of the providers.
Yeah, it's really kind of exciting to see it because, nationally there's a shortage of physicians. And I really kind of see the opportunity going forward to integrate more APRNs into specialty care, to primary care, to every aspect of what we do. Because it creates access points for patients instead of waiting for an appointment. And then I also know some of the APRNs in the community, and there are patients who just exclusively see their APRN. And the quality of the care and what your teachings are and everything else are extraordinary, broad and comprehensive, and you're well prepared for taking care of any of those patient needs. And as you said, we have so many specialists, cardiologists, endocrinologists, rheumatologists. We have the whole cadre of physician specialties in the group to support the patient and you in terms of healthy outcomes,
Yes.
which is great.
Absolutely.
So where do you see this kind of evolving to primary care? Because there's so much focus on primary care.
There is, and there's a huge need that's not going away anytime soon. So just really continuing primary care patients. You know, if we feel the need that patients need referral, more advanced care, then again, we'll refer and kind of go from there.
You know, it's interesting, like the questions that they ask patients now when they come through the hospital. We call it social determinant questions. You know, are there housing insecurities? Do you have food insecurities? Do you, is there any problem in your environment where you don't feel secure or safe? And it feels like to me that in terms of how somebody's health outcome can be impacted by those things is so critical and crucial that I see primary care as kind of like the keeper of identifying those things. Unfortunately, I think the resources that are being brought to bear on those problems aren't necessarily the best. And but when you see those kind of things, or when you talk to patients because you develop these relationships with them, how do you deal with those things? I mean, is there referral centers for that? I mean,
sure. So I ask every single patient, do you feel safe at home? Is anybody harming you? Those sorts of things. And if they answer yes to any of those questions, meaning that somebody is harming them, we provide them with further resources. There's things such as town social workers, case management, that sort of thing, and all in an effort to improve this patient's continuity of care. So all within our multidisciplinary team, between home care, things of that nature, we're able to provide the patients with the best possible outcome.
So when you think about Terryville, Plymouth, and I don't really understand completely, and I should, like the resources there, for housing, social work, you described a whole host of things. Is that community, set and well equipped to deal with those kind of issues?
Well, it's kind of hard to say because it is a little bit of an underserved community, which is awesome that we have a office right in Terryville to be able to help kind of bridge the gap and get those patients the care and the resources that they need. But there is certainly a disparity in that region.
Yeah, and I mean, similarly in Bristol, we have a significant homeless population. But I one of the things that I'm most proud of is our community care coordination team, where we connect those individuals that may be struggling for whatever reason to the resources they need. And some of the success stories are just incredible. Individuals living on the street, getting access to housing, then getting the behavioral health services that they need, the support they need, and then emerging out of all of that into someone with a job, with a completely different trajectory in their life. I keep kind of bringing it back to primary care because across this country, the focus is really through primary care, connecting individuals and improving the health status of the community and everyone's individual health to its highest potential.
Right, absolutely.
I'm curious though, like when you went through your training, how much of that did you get in your APRN program?
Honestly, we really didn't get much. I went to Simmons in Boston, so it being in Boston, it's not really a localized training, so to speak, but we were, educated on nationwide resources that are available, not regional.
Yeah.
So it's all kind of, learning, what the need is and how we can fulfill the need for that specific patient, what their issues are, whether they need more medical research, more medical resources, behavioral health therapy, and it's nice to kind of again bring it back to our Bristol multi-specialty group.
Yeah, it's that's great to understand. I feel like it's the key to unlocking so many individuals' potential, because like you myself had this incredibly environment, of support structure, working in a hospital, helping me along my way, actually helping with my educational costs and everything else, and helping me make all the mistakes I needed to make and, get the feedback. But not everybody gets that opportunity because their focus is on, what's right in front of them, like where am I going to go for my next meal and what am I going to do? And that often means they're going to put off taking care of their body and their health, right? So it's really, I'm very passionate about that, just so you know.
Yeah.
It's one of the things that's on my mind as I become into this senior kind of part of my life, is how can we as community people kind of take what we know and what we experience from the patients that we take care of and turn that around. If you hear, like I go to these chamber events and I hear all the politicians, and I'm a lobbyist, so I spend time at the Capitol. And what you hear a lot about is, oh, you got another $1 billion to do infrastructure, to do this, do this, do this. But yet in the last session, you heard that some of the most vital behavioral health services and access to services in communities hadn't gotten an increase since 2016, and they're struggling. And I think sometimes we don't connect the cause and effect. So, you visit other communities where they've gone through this intense investment and development, and they talk about, oh, there's this new manufacturing company, there's a new building, there's new this, new that, new apartment building. But there's no affordable housing, and there's no access to the fabric of the community, and it ultimately turns into a different outcome. Sometimes, 10, 20 years later. I was just in Seattle, and just to see the difference in 20 years, because they didn't take care of the homeless population. They didn't provide resources. They didn't provide avenues for individuals, really successful avenues to, break a habit or an addiction. So anyway, just.
Right. And that can all kind of tie into primary care, where preventative medicine is, the best type of medicine we can use to, identify early onset cancers with preventative service, such as mammograms, colonoscopies. These things are, essential for your health and well-being. You can't exist without your health. So your health is so important in that way. Yeah. So it's all tied together.
It is, and so I'm really excited about you being there and taking care of a community and bringing that perspective. So, and you got to keep me honest too, because I want to hear about. I don't know enough about that community, and I should, and I would love to hear more about the needs and how we as an organization can help, other than just providing referral sources, for specialists and things like that. Anyway, so tell me, like, what message would you like to leave with the viewing audience about yourself, about your practice, anything?
Sure. Yeah. So Bristol Health is part of a multidisciplinary organization. We have several different specialists, as we established before, and preventative medicine is really the best medicine. It'll, keep people out of the emergency department. It's going to prolong their health by identifying early onset possible curable diseases. It really starts with health. Without your health, you don't have anything. So it really kind of back to basics, primary care, preventative medicine is the best medicine.
So you're like an awesome option for somebody who's looking for a new primary care
Absolutely,
provider. There's no question about that.
Yeah, we are accepting new
You've
patients.
convinced me, by the way. So, but thank you for being here today, and thank you for the journey that you've taken with our organization. It's really extraordinary that. I don't think people realize how much work it is to get where you are, to start as a PCA and then work your way through to this amazing future that you have and take care of people. So thank you and congratulations to you on your success. Truly, truly wonderful to hear this. So this is Bristol Health Cares, and this is your show. And so what I mean by that is you can email us at cares@bristolhospital.org. That's cares@bristolhospital.org with any of your questions or anything you'd like me to deal with on this show, have a host about any healthcare topic. I'm happy to do that. We have some wonderful guests coming up in the future, and I want to thank you so much for joining us. today. And I also want to thank Nutmeg TV for hosting us and sponsoring this program. It's an incredible community resource. Very proud, and just if you would see the extraordinary team that produces this show, you would definitely be amazed and supportive. And they are a nonprofit organization, and they would welcome your donations. So have a wonderful day, and until the next time, this is Bristol Health Cares. Take care.